for anyone watching who has dense breasts. How do you know if you have dense breasts? If you've had a mammography done, which is an X-ray screening tool for your breasts, it will say whether or not you have dense breasts. So there are 4 categories of breast tissue, and the 2 more dense categories are categorized as dense breasts, which basically means that there's a different ratio of fat to other types of tissue in your breasts. And why it matters is that it makes it harder to screen for breast cancer with mammograms. So your insurance company or your doctor may not know that there's a different technique to screen for breast cancer in your case. So if you have dense breasts, you don't need to settle for the answer that, mammography doesn't work well for you, so we don't know if you have cancer. No. Instead, what you should do is you could get something called molecular breast imaging. And what that means is it's a form of imaging your breasts that uses radiation in a different way. It's trying to detect cells that are rapidly dividing, which is what cancer cells do. And so it can see cancer even in dense breasts, whereas mammography is basically an X-ray, like we discussed, and that is really limited just by what the tissue looks like, and cancers can hide in dense breasts. So next time you go see your doctor and are thinking about what screening is available for you, if you have dense breasts, be equipped with this information. Linked below are the places all around the country that do this type of imaging. It's not as commonplace as mammograms, so you have to do a little bit of travel or hunting, but we just want anyone who's watching this who has dense breasts to be empowered and to be able to get what is the best study for your unique biology.